Welcome to our video on circumcision. Today, we'll be discussing the possible risks associated with circumcision, as well as the surgical procedure itself, to help you make an informed decision about this procedure. I am Dr. Fabio, avatar created using artificial intelligence. I am a consultant andrologist and urologist, as well as the founder and director of the Holistic Andrology Clinic in London. I am here to bring you the facts. Circumcision is a surgical procedure that involves the removal of the foreskin from the penis. Although it is a common procedure, it is essential to understand the potential risks, complications, and the irreversible nature of this surgery. The circumcision procedure typically involves the following steps. Anesthesia. This surgery is usually performed under general, local, or spinal anesthesia. Incision and removal. A circular incision is made in the foreskin just below the head of the penis, and the entire foreskin is removed. Closure and dressing. Dissolvable stitches are used to attach the remaining skin to the area below the glands. A protective dressing is applied to the wound. It is crucial to understand that circumcision is a permanent procedure. The removal of the foreskin exposes the glands or head of the penis, which will remain uncovered for the rest of your life. This is irreversible, and it can result in changes to the appearance, sensitivity, and sensation of the penis. While circumcision is generally considered safe, there are potential risks and complications that you should be aware of. These include swelling and bruising, which usually lasts a few days. Altered sensation, which can last for up to 2 weeks. Permanent altered or reduced sensation in your glans penis. Infection of the incision requiring antibiotics or surgical drainage. Bleeding from the wound, occasionally requiring a further procedure. Unsatisfactory cosmetic results and unsatisfactory cosmetic results. After circumcision, it's essential to follow the post-operative instructions provided by your surgeon. Here are some key points to keep in mind during your recovery. Swelling and bruising. Expect some swelling and bruising of the penis, which may last several days. Cosmetic appearance. It can take up to 6 weeks before the penis returns to its final cosmetic appearance. Sensitivity. The exposed glans penis will feel very sensitive for the first 2 weeks, and after the hypersensitivity has settled, your penis may feel a little less sensitive than before the operation. Glans care. The exposed glands may dry out and scab over. Applying a little Vaseline can help with this and decrease sensitivity after the operation. Stitches and dressings. All stitches will dissolve, usually within 2 to 3 weeks. Any dressing should fall off within 24 hours. If it does not, or becomes soaked with urine, remove it. Keeping the area dry. Try to keep the area dry for 24 to 48 hours and avoid soaking in a bath. Swimming and clothing. You should not swim for 2 to 3 weeks, unless approved by your specialist, and wear loose-fitting clothing for 2 to 3 days. Discharge summary and medications. You will be given a copy of your discharge summary, and a copy will also be sent to your GP. Any antibiotics or other tablets you may need will be arranged and dispensed from the hospital pharmacy. Sexual activity. You will continue to get erections as normal after the procedure, but refrain from any sexual activity, including intercourse and masturbation, for 4 weeks. Erections and scar tissue. When you first get erections, you may feel some tightness and discomfort around the scar tissue. This will regain its normal elasticity within a few months. Remember, always follow your surgeon's advice and communicate any concerns or questions you may have during your recovery. Circumcision is a common procedure, but it's essential to be informed about the potential risks, complications, and the irreversible nature of this surgery. Discuss any concerns with your surgeon, and together, we can determine if circumcision is the best option for you. Remember, my priority is your health and well-being. Thank you for watching our video on circumcision. We hope it was helpful to you. If you like what you see here, make sure you subscribe so you can see new videos.